look, every time we go out and look at the fine detail, and it is long, it's quite shocking. And we've talked before, we first looked at how they delayed the lockdown, that the science kind of was behind the rest of the world in pushing for early action. So the lockdown cost lives. We talked before about care homes. That was our last piece, about how delays in recognising care homes, keeping them out of the picture, prioritising other things other than care homes, cost lives. And this one, we look at the failure to get the tests going and to look more widely for the arrival of the virus, which meant we were weeks behind. And again, that cost lives. And, we know that the test was slow to get going. But when we went out there, again, I was really, really shocked by the detail. And what we saw was they unlike other countries, say unlike Germany, we were paralleling Germany right at the beginning. We had a very, very narrow test for COVID-19, which meant we were not picking up the cases. And what I found was that doctors had pleaded for a much wider definition of what COVID was, other symptoms. We had a very, very tight thing, coughs and fever. That was all that would count. And we discovered that the Public Health England were refusing to test people who were outside that category. And you had doctors who were staring at patients they were convinced had COVID-19. They didn't count.
I'm one of them.
Yeah.
I had it. I know now that I had it because I've had the antibody test. And yet when I had it, my symptoms would not have qualified me for a test because my only symptom was a loss of taste and smell, which didn't, I think, kick in until May the 18th.
And there wasn't even a way to record it, after a certain point. They didn't even want you to tell anybody. The NHS didn't want you to dial 111. So now we're seeing a bit of data which is allowing the lockdown of certain institutions, certain places, and particular places, workplaces that like meat factories that might have got it. But all that could have happened months ago if they'd actually engaged with the data and kept testing and had means to follow the spread of the virus. So we worked out they were probably only have picked up about 3% of COVID infections. At best 10%. And that's only a tiny fraction. And that meant that the whole thing was ripping across the country. And the people who could have done something about it, local health directors, didn't have that data. And when the data did come, the other thing, which is pretty shocking, is that they were denied that data. They're not actually given much power at all, these public health directors. The power is with a centrally run agency, the Public Health England. And at various points, the surveillance data was actually classified as an official secret, and until April they weren't even sharing that with Public Health England, with local authorities. And so, whilst in Germany at the end of February, they were ramping up contact tracing. Ramping up seems to have been the phrase of the crisis. They were recruiting volunteers. Hundreds of people to contact trace at a local level, run locally.
Yes. Here
we were cancelling that. And that meant that in Germany, right from the beginning, they were isolating particular places. Because what we found out is this was very concentrated, this infection. And Germany was able to shut off this tower block, this meat plant, this distribution warehouse, all those sort of things to control the virus. And we were going the opposite way.
So whether by accident or design, then, we've ended up aping that Trumpian line about if you do less testing, you get less cases.
That's right. But
do you think it is accident or design?
It's not just an accident.
Right, go on.
Look, you had people who are actively pushing for more tests and wider tests. They had the capacity. We talk about lack of capacity. NHS labs across the country were underused. They actually had capacity. You got one case in Devon, we report there, that they asked to go and test care homes. They're told, back off. This is Public Health England territory, not our thing. You've got labs in London, the Crick Institute. They want to test people outside normal symptoms, asymptomatic health workers. Screen all the health workers. It's blocked. They're not allowed to do that. And what were they afraid of? I think there was a fear that if you found too many people with COVID, you might have to, have too many people off work, cause another crisis, expose the understaffing, that sort of thing. So if it wasn't a design, it was a lack of attention and a politically a failure, if you like, to look out the window at all the things that were happening in countries that were doing well and actually saying, well, let's let's do some of this here.